Good evening and thanks for joining us. We begin with a promise the Prime Minister made to the thousands of people who work in long-term care homes in this country, usually for low pay and often part-time. Justin Trudeau said in mid-April he'd make sure they get a boost in pay, but there was no detail. Today he went a bit further, saying the provinces and territories have agreed to provide a wage top-up.
It will be up to each province and territory to determine who exactly qualifies for this wage increase, but the bottom line is this. If you're risking your health to keep this country moving and you're making minimum wage, you deserve a raise.
The federal government, provinces and territories have committed to spending $4 billion on the top-up. It's unclear who exactly will get it and when they'll get it. What is clear is that people in Canadian long-term care homes have suffered the most in this pandemic. 81% of deaths from COVID-19 are linked to care homes. Hundreds of staff have tested positive. Some have died. There's such a shortage of staff now. Soldiers are looking after seniors in multiple care homes. In Quebec, more than 1,000 troops are supporting 20 long-term care facilities, and that number is expected to grow by mid-May. In Ontario, 256 members are helping in 5 long-term care homes in Pickering, Toronto, and Brampton. This kind of work is not what members of the armed forces signed up for. It's not what they're trained for. But as Mike Armstrong reports, they've found themselves on a new front line.
There is no way to know how many people have died at this Montreal seniors residence. The provincial government stopped making those numbers public last week. At that point, they'd lost close to 50 residents, and Thursday morning, the funeral home van was again taking away a body. It is, according to the soldiers now assigned to this facility, something they're getting used to. Each residence's military team is split into 3 units doing 8-hour shifts. They're on site 24/7. Most of this group is from an armored regiment. This isn't how they'd normally be dressed.
C'est étrange, mais c'est nécessaire parce que...
Trooper Brendan Soucy calls it strange but necessary and says the troops are very careful. At last count, this facility had close to 200 COVID-19 cases, about 2/3 of the entire facility. They were severely short of staff, and what they did have was overwhelmed at times. How much of the soldiers helped?
On peut respirer un petit peu.
We can breathe a bit, says Martine Robichaud. It's a huge support. Now, for most of the troops, what they're doing is completely new, but each team does have Canadian Armed Forces medical personnel attached. To do that, the forces had to pull in medical personnel from across the country, meaning the normal support on bases right now is bare bones.
We are all in and going as quickly as possible in support of this endeavor.
Most regular positions in a long-term care facility take about 700 hours of training. The soldiers have gotten about 5. Their tasks are not medical, but for some they can include moving and even cleaning seniors, many of the things orderlies might do. But there is concern some might have emotional difficulty in a setting where people are dying.
We've put some measures in place to make sure that guys can talk about what they see and how they feel, so there are resources available for us.
The forces are not releasing numbers on how many soldiers contract COVID-19, citing security concerns, but the federal defense minister does admit coming out of this crisis there may be changes. Supporting Canadians in the future could mean the forces need more troops trained for medical emergencies. Mike Armstrong, Global News, Montreal.
In Ontario, about 3/4 of the people who have died from COVID-19 are residents in long-term care. There are outbreaks reported in 225 facilities now, and 681 deaths have been reported. Ontario's premier said again today the system needs to be fixed.
We know the system's broken, but we're going to have a complete review, not just of long-term care. I think the whole system of government. There's better ways of doing things. We've all seen it, more efficient ways of doing things, and there's definitely going to be a review.
There's so much information surrounding coronavirus out there now. We know you have questions. Email your questions at globalnews.ca. Tune in to Global National or go to globalnews.ca/coronavirus now to find the answers.